comprehensive approach that we've been talking about to drive those numbers down. And we owe this to ourselves and the rest of the world to do everything we can to make sure that those predictions do not become a reality.
Thank you, Maria. So now I have a question. We're moving around the globe to Greece. Kostas from ERT, are you on the line?
Yes, I'm on the line. Do you hear me?
Please go ahead.
I'm going to ask a question to Dr. General. Give us, please, an update about the vaccine research. How far away are we from the lucky first day to win COVID-19?
Question about the vaccine.
So we are working across with the research and development blueprint, the R&D blueprint, with a number of scientists and researchers all over the globe. And one of the areas that we are working on is the acceleration of vaccine development. Not just us, we're working with people across the globe. There's at least 20 vaccines that are in development for COVID-19. And you heard us report, I think, Mike, you can give a little more detail on this, of the first trials that are starting 60 days after the virus was sequenced, if I'm not mistaken. The acceleration of this process is really, truly dramatic in terms of what we are able to do, building on work that started with SARS, that started with MERS, and now being used for COVID-19. We're still some time away before we would have a vaccine that could be used, and they still need to go through the trials to look at efficacy. But this work is underway, and we are very grateful for all of the partners that are working to get these clinical trials underway. Mike?
Yeah, well, maybe I can supplement again, yes, and very pleased to see the work accelerating, and we thank our colleagues in CEPI, but also working very closely with Seth Berkley and his colleagues at the Gavi and many, many others, the Gates Foundation and others. I think beyond the scientific research to vaccine, and it's fantastic to see the innovation going on to develop vaccine candidates and to take those candidates through the necessary testing. And many people are asking, well, why do we have to test the vaccines? Why don't we just make the vaccines and give them to people? Well, the world has learned many lessons in the mass use of vaccines, and there's only one thing more dangerous than a bad virus, and that's a bad vaccine. So we have to be very, very, very careful in developing any product that we're going to inject into potentially most of the world's population. We have to be very, very, very careful that we first do no harm. So that's why people are being careful. Well, to be 8 weeks into a major event of a new disease and have a vaccine going into the arm of a volunteer this week is just unprecedented in its speed, and that would never have happened had countries not put the genetic sequences out in public. And I think that again shows why solidarity is so important. But we will face another challenge down the line, and one that the Director General is very concerned about and is reaching out to other institutions like Gavi and others to discuss right now. And that is that even if we get a vaccine that's effective, we have to have that vaccine available for everybody. There has to be fair and equitable access to such a vaccine, not just for ethics reasons, but because the world will not be protected until everyone is protected. So in that sense, there are other hurdles to cross now, not just the hurdles of science, but the hurdles of how do we scale up the production of such a vaccine? How do we ensure we get enough of that vaccine in time? How do we distribute that vaccine to populations all over the world? And how do we convince people to take the vaccine? Because you've all seen over the last few years the loss of confidence in vaccines. It's one thing having a vaccine, but people need to avail of that vaccine. So there's a lot of work to do, and the Director General will be leading a process with other organisations to address the issues of production, scale-up, financing, advanced market commitments, and fair and equitable distribution of those vaccines, and has already been reaching out to major institutions and global health leaders on this.
On the vaccines, one thing I would like to stress, as Mike said, is one, the speed is really unprecedented. In 60 days, to have the first person to be enrolled in vaccine trial is really amazing. I hope the vaccines under trial work. And at the same time, though, before even we have the vaccine, as Mike said, we have to prepare so that the vaccines can reach everybody who needs it. Because this vaccine should not be for the haves. It should be for those who cannot afford it too. So we need to answer that question as early as possible. But the solidarity we're witnessing is very, very encouraging. My colleagues were sending me a text about another solidarity. This solidarity, which we're saying is a solidarity of scientists who came together, as you remember, 6 weeks ago to find solutions, diagnostics, treatment, and vaccines. And then the other solidarity is the financing, the Solidarity Response Fund. As you know, we started it last week, and today we have mobilized already $66 million US. This is a record. But it's not the money. 175,000 people were involved in 1 week. And not only that, there is an outpouring support which is still flowing, and including many stories that really touch our hearts. I will give you some of the stories. In New York, a theater group started a virtual singing challenge, getting people to donate. And in Ireland, Mike's country, Karen Ford is staying active and pledging 4,000 squats in GoFundMe campaign to support the fund. And then online, a popular video game streamer started hosting regular fundraisers with his followers. Very innovative, and on and on. I don't want to take time on this, but these are stories of solidarity. And when humanity is confronted with a common enemy like this, it also gives us a chance to bring the best of us. And that's what we need, solidarity in everything. And with that kind of solidarity, which is, we said it last week, which is more infectious than the virus itself, we will be able to stop this virus.
On that note, I'm going to close this press conference. It's so important that we all stay positive. I'm so sorry to the 277 journalists online that you didn't get to ask your questions. We will be sending the transcript out. We'll also send the number of the WhatsApp chatbot. You just have to put in +41 798 931 892 and send the word hi. But we'll send it to you so you can all use it and see what a great chatbot it is. And we will also send the usual audio files. Thank you so much for joining this briefing today. Goodbye.
Goodbye. Thank you, and bon weekend. Have a nice weekend.